Hi, Karen. You're on with Simone Perry with Good News Broadcast. Thank you so much for being with us today.
Absolutely. Thank you.
Karen, first of all, please tell me a little bit more about the Children's Health Fund.
Okay. The Children's Health Fund is an organization that's dedicated to providing health care to medically underserved kids here in New York City and around the country. We have a national network of 24 programs, and we use a mobile medical model to bring healthcare providers to kids in neighborhoods and communities where there are very few doctors and the families have difficulty accessing care. So we use mobile medical clinics, basically 35-foot long, custom-designed doctor's office on wheels, and partner with local healthcare institutions so that we can bring primary care services directly to kids in schools and community centers and homeless shelters and many, many sites and locations around the country.
Okay. Now, what do the mobile medical clinics consist of? What types of checkups can they get through there?
Right. Well, basically, we on our mobile clinics are teams of primary care providers, so basically a pediatrician, a nurse, a registrar, and a driver, outreach person, and there's 2 exam rooms and a nurse's station and a small waiting area. We also use electronic health records so that we have access to the patient's medical records at all times. So these mobile clinics go to sites on a regular basis. So they have like a weekly schedule, let's say where they go to a homeless shelter, 5 different homeless shelters in 1 week, and then every week they go to those same 5 shelters on a regular schedule. So the doctors there provide a medical home really for the patients that they see. So they can do everything a pediatrician does in his or her more traditional office. It's primary care, preventive care, immunizations. It's taking care of acute illness, asthma, infections of all types. A lot of the kids that we see have not been to a physician on a regular basis for many years, and so our doctors are able to identify, congenital problems or complicated illnesses that haven't been managed well. So we make referrals to subspecialists to handle anything complicated. We also have a very comprehensive model of care. So we use, many of our teams have social workers as part of the team. So we take care of social service needs and do also mental health counseling. We provide transportation and referrals to food pantries and,
That's amazing. Now, why are you finding that so many people have to utilize the mobile health care?
Well, the reality is that there are millions of children in this country that don't have health insurance, and many of them, may be in families where the parent is working, but there's no health insurance provided by that job, or they live in communities, maybe a child is on Medicaid, but they live in poor communities where there are no doctors, or the doctors don't take Medicaid as a form of payment. So there are many, many communities where children just aren't getting the regular care that they need. So, we developed a model and targeted the most high-risk communities to bring high-quality medical staff into these communities to provide that care.
Now talk about your partnership with Clorox.
Well, we're very excited. This is the 2nd year in a row that the Children's Health Fund has partnered with Clorox to really raise awareness about the needs of children around the country who are medically underserved. And so this year, they've developed a program called Check-ins for Checkups.
Right, I'm looking at the site. It's amazing. Tell us a little bit more about how this works.
Right. So basically what would happen is, by getting the word out about the need for children, for children's health care, people can come onto this site and kind of log in their own healthy behaviors and think about what's important for good health for themselves and their children. But at the same time, when they check in, Clorox will donate 10 cents for every time someone checks in and about a healthy behavior. So they're raising money really for the Children's Health Fund as part of that process. So they'll be getting the word out about this new concept and raising up to $100,000 for the Children's Health Fund to support the medical care that we provide to the kids in different communities.
Now, going back to the mobile medical clinic, how do people need to be referred? How can they access these medical clinics?
Well, in every community, there's a sort of a target for there's a patient population that the mobile program focuses on. Mm-hmm. Here in New York City, we provide health care to homeless children living with their families in homeless shelters around the city. So we have 13 different shelters that we go to every week. Okay. So that we work with the shelters, and the shelter staff informs the patients, especially the new ones that are coming into the shelter, about the schedule of the mobile team. So they know that every Tuesday there'll be a mobile team on site, right. Okay. And they can access the care. So that's what happens in every different community. Some of the mobile programs go to schools, some go to housing projects, mm-hmm. community centers, but there's a regular schedule and a collaboration with the community-based program.
Now, do you work with prenatal? And I ask this because Good News broadcast, we work closely with Text for Baby. Are you familiar with Text for Baby?
Yes, we are.
Yeah.
The majority of our programs are just focused on children, mm-hmm. in terms of providing care to kids. But some of the programs do provide adolescent care and care for early young adults. And in that situation, either they make referrals to other programs for prenatal care, but don't provide prenatal care per se.
Sure. And Karen, you've been wonderful, and I have one last question, and this is a question that we ask all of our guests. What's good news for you?
Good news is having people know about the needs of children in our country, care about them, and try to help improve everything that children need to be able to contribute to our society. So, really helping children at an early age get what they need to become productive and healthy adults for our community.
Karen, thank you so much for being with us on Good News Broadcast today.
You're very welcome. Thank you.